Hey, good morning. I'm Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness, and welcome to another one of my small little podcasts, for lack of a better word. So, today I'm going to speak about endometriosis and infertility and how to overcome this infertile state and grow or start your family. So, first, let's talk a little bit about endometriosis. What is it? Endometriosis is a pathological state whereby endometrial tissue, which is to say tissue that resides in the uterus, finds itself in other parts of the body. And when these endometriotic deposits are manifest in other parts of the body, they invaginate into the tissue, meaning they dig into the tissue, they press on the nerves, causing severe pain, and they also bleed at the time of menstruation. So you have all kinds of bleeding in different areas of the body that also can negatively impinge upon, and perhaps even degrade the effects of neuronal pathways, causing additional pain. The other important thing to know about endometriosis, though, is that even though endometriosis is by definition a disease that takes place out of the uterus, women with endometriosis have inflammatory proteins that present in the uterus, because these endometriotic deposits secrete what's called pro-inflammatory cytokines. Let's just think of it as inflammatory processes that do, interestingly, wind up in the uterine cavity. So here's the problem. So number one, the uterus maintains a temperature with some minor variation of the standard, some minor deviation from the standard, but the uterus must maintain its normal temperature and environment. And when you have pro-inflammatory cytokines circulating in the uterus, essentially what you have is a uterine environment that's inflammatory. So you can see how that, in and of itself, can contribute to infertility. Of course, endometriosis can contribute to infertility by causing tubal obstruction. So the reproductive endocrinologist will say, well, we can negate the pathology of tubal obstruction by doing in vitro fertilization. So that's all well and good, and it's often effective, and women do end up getting pregnant and having babies, but a lot of women don't. And here's why. So endometriotic tissue looks either black or purple or brown, and so when the laparoscopic surgeon is in the pelvic environment, lysing or eradicating, resecting endometriotic tissue, some of that tissue may be in fact missed and not eradicated. Why not? Because some endometriotic tissue looks the same as normal, healthy, pink tissue. So the laparoscopic surgeon can't take out what he or she cannot see. So therefore, women that undergo laparoscopic intervention to eradicate endometriosis often still end up having endometriosis. So what those women find is that they don't get pregnant, and they wonder why, and the doctor often wonders why. So when we see a patient that's had a laparoscopy, and besides having the history of endometriosis is within normal limits, which is to say her hormones are in normal limits, and her partner's sperm is totally within normal limits, and there's no physical abnormalities, a septate uterus, or something that's going to prevent pregnancy from ensuing. Why isn't the pregnancy happening? Because, as I said, there's probably still some remaining endometriotic tissue that's unrecognized in the uterine cavity. So here comes acupuncture and herbal medicine as the intervention secondary to laparoscopic resection of endometriotic tissue. So how acupuncture and herbal medicine can help the patient conceive even though she has had a laparoscopic intervention and has no more endometriosis, is by reducing or completely eradicating this pathological inflammatory milieu in the uterine environment. Once that happens, there will be a uterine environment that is within normal limits, and it should be rather not hostile, but in fact friendly and welcoming to the development of an ongoing embryo and subsequent fetus. So acupuncture and herbs are very good to use with patients who have had endometriosis and have had laparoscopies and are within normal limits but still can't conceive. So remember, acupuncture and herbs are very good in the endometriosis patient because these two modalities of medical intervention serve to eliminate or greatly reduce the inflammatory process that's manifesting in the uterus. So if you have any more questions or comments, we'd love to hear from you. If you're interested in being a patient, we'd love to hear from you. It's the Berkeley Center for Reproductive Wellness. The website is berkeleycenter.com. That's BERKLEYCENTER, berkeleycenter.com. Our phone number is 212-685-0985. Even if you're under the care of another acupuncturist, I'm happy to take your questions and your calls and just try to answer questions and make life a little bit easier for you. I look forward to speaking with you and maybe even to meeting you. Take care. Good luck on your journey. All the best. Bye.